Hey everybody, this is Dr. Sadler again with your question of the week. Okay, so this week's question says the nurse would include which interventions in the plan of care for a client with hypothyroidism? Select all that apply. So here we are with our dreaded select all that apply questions. I know people hate these select all that applies, but just take it one response at a time. So go through one. Is this true or false? Yes or no. Two. Is this true or false? Yes or no. Three. Is this true or false? Yes or no. And go through each one like that. Don't take it. I've had students to say, oh, I've only got two responses. That can't be enough. Or I got five. That should be too much. That might be too much. So don't look at it like that. You're going to just go through each one to determine is it true or false. Okay. So let's look at our potential responses. One, provide a cool environment for the client. Two, instruct the client to consume a high fat diet. Three, instruct the client about thyroid replacement therapy. Four, encourage the client to consume fluids and high fiber foods in the diet. Five, inform the client that iodine preparations will be prescribed to treat the disorder. Or six, instruct the client to contact the primary healthcare provider if episodes of chest pain occur. So first of all, let's think about what is hypothyroidism. What happens with hypothyroidism, I should say. What happens with hypothyroidism is the metabolism decreases, the person's metabolism decreases. So things start to slow down in the body. So things are slowing down. You're getting sluggish. You're gaining weight because your metabolism's decreasing. Even in your intestine, things are slowing down. So things are slowing down, so you're at risk for constipation. So metabolism is decreasing, things are slowing down. Okay. So let's go through each one. So, do we want to provide a cool environment for the client? So, individuals with hypothyroidism actually have a cold intolerance. So, they're cold. So, no, we don't want to provide a cool environment. We actually want to do things to try to keep them warm because they have a cold intolerance. So, we're not going to provide a cool environment for this person. Two, instruct the client to consume a high fat diet. We just said they're gaining weight because their metabolism is so slow. So we don't want a high fat diet. We want a low fat diet because we don't want them to keep gaining even more weight. So low fat diet. Instruct the client about thyroid replacement therapy. So remember, hypo, use your prefixes and suffixes when you're trying to determine what different words indicate. Remember, if it says hypo in front of it, then that means less than, under. So hypothyroidism, not enough of the thyroid hormone. So therefore, we need to replace the thyroid hormone. So yes, we will need to instruct the client about a thyroid replacement therapy. So typically, it's going to be your Synthroid, also called your levothyroxine. Encourage the client to consume fluids and high fiber foods in the diet. Remember, we said things are slowing down, so this person is at risk for constipation. So, what kind of things are we going to do for this person to try to prevent constipation? You're going to encourage high fiber foods and you're going to increase the fluids to try to combat that constipation. So, yes, we want to do number four. Number five, do we want to inform the client that iodine preparations will be prescribed to treat the disorder? So the iodine preparations are typically used for your person with HYPER, hyperthyroidism, because the iodine preparation will, help decrease the blood flow to the thyroid. So we don't want to do that in this scenario. Number six, instruct the client to contact the primary healthcare provider if episodes of chest pain occur. You definitely want to contact your provider if you're having chest pains. But in this particular situation with hypothyroidism, if a person is getting too much of the thyroid replacement, they could start to have chest pains. So that's how it fits into this particular scenario. So yes, we want to do that. So we said our answers were number 3, we're going to instruct the client about thyroid replacement therapy. Number 4, we're going to encourage the client to consume fluids and high fiber foods in the diet. And number 6, we're going to instruct the client to contact the primary healthcare provider if episodes of chest pain occur. So, as we stated, our answers were 3, 4, and 6. So let's read the rationale. The clinical manifestations of hypothyroidism are the result of a decreased metabolism from low levels of thyroid hormone. The interventions are aimed at replacement of the hormone and providing measures to support the signs and symptoms related to decreased metabolism. The client often has a cold intolerance and requires a warm environment. The nurse encourages the client to consume a well-balanced diet that is low in fat for weight reduction and high in fluids and high fiber foods to prevent constipation. Iodine preparations may be used to treat hyperthyroidism. Iodine preparations decrease blood flow to the thyroid gland and reduce the production and release of the thyroid hormone. They are not used to treat hypothyroidism. The client is instructed to notify the primary healthcare provider if chest pain occurs because it could be an indication of over-replacement of thyroid hormone. So that concludes our question of the week. Thank you for joining me again this week. If you enjoyed listening to this question of the week and you would like to hear more like it, then please consider subscribing to my YouTube channel. Thank you and enjoy your week.